pathology in this X-ray?
There are no lung markings in the left lung field, and the left lung is collapsed. You can see tracheal deviation to the right side with mediastinal shift. The diaphragm is also depressed, showing there is a large left-sided tension pneumothorax.
Question 2. What does this show?
This X-ray shows a misplaced NG tube. When correctly placed, the NG tube should bisect the carina, and the tip should be clearly visible below the left hemidiaphragm. This X-ray also shows an old healed rib fracture.
Question 3. What does this show?
There is a large area of homogeneous opacification over 2/3 of the right lung field. You can clearly see a meniscus sign and loss of the phrenic angle. The findings are consistent of a large right-sided pleural effusion.
Question 4. What does this show?
There is bowel in the lower half of the left hemithorax, mildly displacing the heart to the right. A large gastric fluid level is visible in the stomach, and there are left-sided rib fractures. These findings are consistent with a traumatic diaphragm rupture.
How about this one?
There are multiple well-defined bilateral irregular shadows that are as dense as bones, and there is peripheral pleural thickening. The findings are consistent with multiple pleural plaques.
I bet you don't know the pathology in this X-ray.
This X-ray shows a left upper lobe mass which is compressing multiple structures, including the left phrenic nerve, causing the diaphragm to become raised. The findings are consistent with lung cancer and a phrenic nerve palsy.
Question 7.
This X-ray shows abnormal bulging of the mediastinal silhouette with a large dilated aortic arch and descending aorta. This is displacing the trachea to the right and mildly narrowing it. The findings are consistent with a large thoracic aortic aneurysm.
Question 8. How about this one?
This X-ray shows a large amount of opacification in the left lung with associated mediastinal and tracheal shift, likely reflecting collapse of the left lower lobe. There is also a fracture of the 7th rib on the left and right side, and a small left apical rim of air, probably a small pneumothorax.
Question 9. I bet you can't guess this one.
There is bilateral hilar adenopathy, and there is nodular infiltrates throughout both lung fields with sparing of the bases. The features are consistent with sarcoidosis.
Question 10. What is this?
There are multiple rounded ring shadows in the right upper lung. A central line has been inserted, and there is a chest drain in the left mid-zone. This finding is called plombage, and it's from TB.
Last one. How about this one?
Put the answer in the comments.